Big revelations today about Austin Public Health's efforts to slow the spread of the coronavirus. The local health authority says our community has become over-reliant on contact tracing, and it hasn't been as effective as you might think. KXAN's Jacqueline Powell recently tested positive for COVID-19. She's reporting from home to share her own experience with contact tracing delays.
Travis County Health Authority Mark Escott says it's not uncommon for someone who tests positive for COVID-19 to go a week to 10 days before ever hearing from a contact tracer.
If we are spending hundreds of millions of dollars on contact tracing, but we don't have a solution that gets results in a timely fashion, it's a wasted investment.
And the reason for that wasted investment might surprise you. Escott says even though the state mandated that labs must enter test results digitally and in a timely manner, in many cases,
the cases we receive come in by fax machine. And sometimes those faxes are positives and sometimes they're negatives. Sometimes they have information like the person's phone number that was tested and sometimes they don't. So we have a whole team of people who have to sort through more than 1,000 faxes a day to sort out the positives versus the negatives.
Then he says contact tracers often have to spend more time calling labs and doctors' offices to track down more information for those positive cases.
I've been at home quarantining for a little more than 2 weeks now. Now, as soon as I started showing symptoms, I went ahead and registered for testing through Austin Public Health. It took me a few days before I could get into one of their drive-through testing sites, but once I did, I got my positive results back in just a couple of days. It took more than a week after I gave that positive test sample, though, to ever hear from a contact tracer. And by that point, I had been sick for about 2 weeks, and contact tracing for my specific case wouldn't really do anyone any good.
Dr. Escott calls it an archaic process that's rendered even more ineffective by the state opening back up.
When we look at the efficacy of contact tracing in other countries where it worked, that contact tracing happened when the places generally were shut down, when people weren't moving around. That's not what we're doing here.
Jacqueline Powell, KXAN News.
Today, county commissioners asked Dr. Escott to give them the names of labs not following the state's orders to send results digitally so they can take legal action against those slowing down the reporting and contact tracing process.